Honorable Opposition Leader, Political Leader, and former Prime Minister, Mrs. Kamala Persad-Bissessar, my colleagues on the platform tonight, and all those listening and viewing through the various media houses and those who are streaming live. A very good evening to each and every one of you. Tonight, I will respond to Prime Minister Rowley and Minister Dayal Singh's vicious, audacious, and outright lies, masking their serious incompetence and their deceitful and hypocritical statements misleading the population. From the onset of this pandemic in November 2019 and WHO declaration in March 2020, they began their lies of their preparedness when they were never really prepared. They lied about their under-testing, their non-tracing, they lied about the horrible quarantine situations and their personal protective equipment insufficiencies. They lied about their being number one in the world. They lied about the vaccine availability, and when Prime Minister said he doesn't want to be begging for these vaccines. They lied about the medical and nursing and paraprofessional staffing when they were terribly understaffed. In the midst of this gross understaffing, they began to lie again about the ventilators availability. Only 24 were available throughout the country, and saying that 72 could have been available throughout the medical institutions. They lied about the critical drugs availability, with basic life-saving drugs not available in the ICU or in HDUs, and even in the emergency departments. They lied about the ICU-trained nurses and the shortages. We knew that there was insufficient amount of nurses to man the HDU and the ICUs and the emergency departments. They lied about the nursing and doctors' contracts when no contracts were given to them. They lied about the transfer of senior, experienced doctors from Cuba to Arima hospitals. 18 senior doctors had been transferred, and they just said that they needed rest. These are just some of the few dangerous lies that were perpetrated by this administration. Today, in Trinidad and Tobago, over 1,850 unfortunate citizens have lost their lives to COVID-19 infection. From January to April, 42 persons died. But in the devastating 6 months of May to October, 1,530 COVID-19 deaths occurred. And now in November, over 160 deaths so far, almost 11 per day. And on Saturday, 22 deaths. Trinidad and Tobago death rate is one of the worst in the Caribbean. It is, in fact, the worst in the Caribbean per million population. And in comparison with many other Latin American countries, we are one of the worst in terms of the deaths that are occurring. And Johns Hopkins University showed that 1,303 deaths per million population for Trinidad and Tobago. Jamaica has by far less, 780 deaths per million population, and Bahamas, 650 per million population. Well, of course, we know that USA, 2,300 per million, Brazil, 2,800 per million, UK, 2,100 per million, Russia, 1,700 per million, France, 1,674 per million population, South Africa, 1,627. We are ranked number 47 in 203 countries. Trinidad and Tobago is worse than 156 countries globally. We are worse than Puerto Rico. I'll give some examples: West Bank and Gaza and Kazakhstan, Guatemala, Malaysia, Canada, Libya, Azerbaijan, Cuba, Iraq. And ladies and gentlemen, on Sunday, 2 days ago, Minister Dayal Singh and Prime Minister Rowley, you launched a dangerous, shameful, and intolerable attack on the medical professionals by specifying private doctors treating COVID-19 patients. You accuse private doctors of using ivermectin, antibiotics, alternative medicine, home oxygen, and treatments which failed and causing individuals to deteriorate. Dr. Rowley, let me remind you, You're a doctor of pebbles, stones, and rocks. You're not a doctor of medicine. This is an attack on hundreds of very experienced senior medical professionals and private doctors. I condemn you this evening and your 2x4 druggist and wannabe doctor for your unwarranted, intolerable attack on the medical profession. Doctors who strive on a daily basis for excellence and best practice in saving patients' lives minute to minute. You have no credibility or right whatsoever to make negative comments on the competence of these doctors. Are these not the same medical professionals that you recently, and I, and hundreds of thousands more seek medical advice and management from? Get back in your crease, Prime Minister Rowley. You have been stumped. And Bush Dr. Dayal Singh, you should have been fired long ago for your dangerous mismanagement of this pandemic. Or if you had any moral conscience or integrity, or if you still have, you should resign or should have resigned, as so many ministers of health have done when they fail their people. Resign now, Terence. You have failed the people. Resign now, Prime Minister Rowley. You have failed the people. You must follow a few of the prime ministers globally, like Japan Prime Minister, and resign. The people are fed up with you and your team and your daily arrogance and incompetence and hypocrisy. They don't want you anymore. Your polls are showing that you are not wanted. And today, I read in the newspaper yesterday, the newspaper reporting, despair is setting in on you, Prime Minister. Your team and the 2x2 druggists, it's a serious criminal incompetence being unmasked. It's no despair. You know you have failed. You have failed the people. 1,850 people have died. Druggists, are you crying once more for the 1,850 who have died? You all are a real total waste. Where is your education program to answer the questions and concerns and apprehensions and fears of the 600,000 citizens still who are hesitant in taking the vaccine? And let me say now, I advise each and every one of you citizens outside there who have not taken the vaccine, there's relatively no contraindication to not acceptance of the vaccine. You should go and avail yourselves of it. Go and have your double dose vaccine. It will reduce the incidence of you having to go in intensive care unit and being critically ill. So why didn't the Prime Minister assemble a team of senior professional doctors and nurses and behavioral psychologists and psychiatrists to continue to educate the population? The president of PAHO for Caribbean and Latin America asked countries to do so and speak to populations in public places, but you have not allowed that to happen. Now, when our 10,000 citizens about a month ago tested positive and in home quarantine, no one from your health teams cared for them. They don't even receive your 10 cents paracetamol and cheap cough medicine. They are left to fend for themselves. No care, no medical attention, and they are left to suffer and become critically ill at home, and some die at home in ambulances and emergency tents. And you are talking, Prime Minister, and 4x4 druggists, you're talking of the patients are being attended to by private doctors and people, and they're not getting better. Do you know, Prime Minister, how dangerous it is to mislead people about their health? You're now trying to bully and shout at people for seeking medical attention from experienced doctors. It is as if you want these patients to die from COVID. You have provided absolutely nothing for patients at home. No pulse oximeters, no oxygen concentrators, no medication, no clinical support. And you are condemning these doctors for prescribing antibiotics and oxygen at home. They give the same oxygen and antibiotics at the hospital. Are you aware that IV antibiotics is given in the HDU intravenously, almost twice a day for 3 days? Prime Minister, your government has ignored these patients at home, and you condemn them when they seek medical attention. How shameless and disgraceful by both you and your Minister of Health. What an evil and dangerous statement you have made from you, Prime Minister. This is simply untenable and unacceptable, and the height of gross irresponsibility from you, Prime Minister. You are endangering people's safety and lives. This borders on criminal. I call on the Medical Board and Council and the Medical Association to condemn you and defend the medical professionals who are attacked. Patients are afraid to go to hospitals because they know that if they ever deteriorate and reach the ICU, they will die. You have rejected advice and professionals' care from 18 very senior experienced doctors at Couva and Mount Hope hospitals. And you have put your friends and family to run NCRHA like the carnival man, Davlin Thomas. Imagine, Prime Minister Rowley, you attacking private doctors for saving COVID-19 patients' lives when you have the unqualified PNM political hack, your sacred cow, for whatever special hold he has on you, Prime Minister, and Minister Diyal Singh, sacred cow. He's qualified to put mics and speakers and boom boxes on a stage for carnival fetes by his own admission. This carnival stage manager is running the health system at NCRHA. Do you expect any better results? You have no appropriate medicine at the ICUs and HDUs. WHO has approved remdesivir, which is an antiviral, 6 injections to a patient costing $700 each, and 1 ampoule of the monoclonal antibody tocilizumab, which is about $5,500, less than $10,000 per patient to save their lives. Over 1,500 patients' lives could have been saved if these drugs were used and available. That's why we call for a commission of inquiry and a confidential inquiry into the deaths of these 1,800 plus unfortunate patients. Daily, families of patients in ICUs are called to purchase so many basic drugs to help their loved ones. Basic anti-inflammatory bronchodilators for nebulizers you don't have, and so many more. Are you not ashamed after you said you spent $5 billion on this COVID-19 pandemic? Where did the money go? You cannot provide basic things, drugs to save lives. Every life is precious, Prime Minister. Every life is precious, 2x4 druggists. On Saturday, Rowley claimed that the opposition leader has been blaming the healthcare providers. What a nasty, audacious, and vicious lie from you, Prime Minister Rowley. The opposition leader and all of us have blamed you and your inexperienced team, clinical team of advisors, and your 2x4 druggists. The opposition leader has never blamed the healthcare providers. In fact, at every opportunity, she thanks them sincerely and congratulates them on their tremendous sacrifice. Prime Minister, you and your 2x4 druggists and your team transferred a number of senior experienced doctors from Couva to Arima and then fired them. You fired them because they were speaking out on the atrocities of the management of Davlin Thomas and his team. And these are healthcare people committed to ensuring patient safety. Why did you fire them? Why have you gagged them and threatened them? Prime Minister, your dictatorship, autocracy, and totalitarianism are naked. You're hypocritically saying the healthcare professionals are tired, but you're firing them. Are you really true to yourself, or just a big fake? If that is not abuse of power, then what is? It is abuse of their professionalism. It's advantageous, callous, and unkind and disrespectful. Don't tell lies. Don't blame others for your criminal negligence and gross mismanagement. Is this a sign of mental confusion by you, Honorable Prime Minister? Be careful. The opposition leader and her team have mounted courageous and unwavering defense of our democracy, fighting against PNM's oppression on the citizens, our right to live in accordance with our democratic principles, fighting for the dignity and well-being of every single citizen, for equality and justice with courage, compassion, and resolve. Time to take back our country from tyrants. Ladies and gentlemen, this is not just a fight for the UN, from the UNC. It is a fight of every one of our citizens. Where are our independent civil society groups? If UNC was in governance, the voices would be loud, demonstrations against us. Where are the business groups, the trade unions, the legal association, the NGOs? It is your patriotic and national duty to stand up against this tyrannical reign from this government, and that has been now unleashed for the past 6 years. It is inexcusable that now, in our nation's most desperate time of need, when our democracy, our economic standing, and social stability are tethering on the brink of collapse, our key groups in all sectors have gone quiet and are remaining so for too long. Why is it this so? Is it that the members of these organizations are terrified of Rowley and his government, the punitive, destructive, and vengeful onslaught in and out of Parliament? Are you afraid if you speak out, the government will seek to humiliate, slander, and destroy you? Tonight, as I close, I ask the young generations to familiarize yourselves with the knowledge of PNM's tyrannical governance since independence. 43 years of their reign of terror and destruction of this country. Educate yourselves, the young generation, on the oppression of the people by successive PNM prime ministers and their governments. We have now one now. We had in the past from the PNM. So don't be silent. How much more are you willing to quietly absorb? Do your duty. Stand up for your country and for our democracy. You must not be afraid of your government. Don't be afraid of Rowley and his bunch of incompetent, unqualified misfits. Government should be afraid of their people. Either we are all free or we fail. Democracy must belong to us all. Stand up and be counted. God bless. Thank you very much. Good evening.